There we go. Good morning. Thanks so much for joining us for this healthcare virtual job spotlight. My name is Lynn April, and I am the Director of Education for Economic Development at CESA 8 in Gillett, Wisconsin. We, along with CESA 7, the Ahnapee Youth Apprenticeship Consortium, UWGB, NWTC, and Inspire Northeast Wisconsin, are sponsoring these virtual job spotlights. So today we are I'm still admitting folks, so as they pop up, there we go. I get a little distracted. We have 3 guests with us today. So we are going to be hearing from April Flynn, who is a certified dental and orthodontic assistant, Dr. Adam Eicher, who is an ER physician, and Jason Helgeson, who is in healthcare administration as the VP of clinical operations for Pravea. And there we go. Next week, we are going to be focusing specifically on all of our healthcare education folks. So you will be hearing from Scott Anderson, who is the Dean of Health Sciences and Education at NWTC, Amanda Nelson, who is Associate Dean for the College of Science, Engineering, and Technology at Bellin College, at UWGB, and then Benny Reith, not Ben, I forgot to change it. So Allison, can you give me the name of the person that is going to be presenting instead?
I believe it's Claire.
Okay. But she will be joining us from Bellin College. She'll be hearing from all 3 of those entities. If you know anybody who still has to register, the registration link is on the bottom of the screen. We'll put that in the chat at the end of the presentation today. So just a reminder of our norms. The meeting is being recorded and will be broadcast after the presentation through Inspire Northeast Wisconsin. Everyone is muted and their video capabilities are turned off, and please leave it that way. If you have questions, we have a way for you to do that, and I'll tell you about that in a second. I'll be sharing my screen for the presenters, so you'll be able to see everything. You'll be able to see both the presenters and if they have any slides to share. If you do leave the meeting, you may not be able to get back in, although I will try to watch to allow people in from the waiting room. But your way to get involved in this presentation is through the chat. So if you have questions of any of our presenters, we'll stop after each presenter. So you will have time to ask that particular presenter any questions you have about anything that they covered. And we really encourage students and staff to ask those questions in the chat. And we never anticipate needing to do this, but we do have the ability to remove anyone from the meeting if they are becoming distracting. So just a reminder that we're looking at healthcare. So in the world of career maps, that's called patient care. And for students in Wisconsin, you should be seeing more of these over the next coming years. We are just getting started with what's called the Pathway Project in Wisconsin. And it's really going to lay out for students exactly what you need to do in high school in order to start on your pathway in healthcare. And then this is the page that we actually create with our healthcare partners. So you can see that healthcare is kind of divided into these 4 subsectors. Direct care, nursing, and behavioral health are all found under the therapeutic services, and then diagnostic services. So today's occupations really would fall under that direct care sub-pathway under patient care. But if you are a high school student in Wisconsin, you, as I said, will probably start seeing more of these pathways in healthcare, in business administration, in manufacturing. So ask your school counselor if you have any pathways yet and what those might look like. All right, so I do have a poll, which I'm going to pop up since our first speaker, April, is a dental assistant. The question is, what level of education do you think is required to start a position as a dental assistant? Do you think that you can get into a dental assistant position with just your high school diploma? Do you need some kind of special certification, or do you need that 2-year associate degree? So I'll give you a few minutes. We have our folks jumping in, and it looks like kind of going back and forth between that certification program and that associate degree. So we are going to find out from April what the right answer is to that, what kind of education you do need to get started as a dental assistant. It looks like 2 years just squeaked out the certification program. I'm going to end the poll and share results and then stop sharing so that hopefully it goes away. So Allison, let me know if that has now gone away. We've had that happen in the past. All right, we are ready to roll. Okay, so we are going to hear first from our first guest, who is April Flynn. She's a certified dental and orthodontic assistant, and I'm going to stop sharing so you can see her on the screen because she's going to show us a little bit about her environment today as she's sharing about her career.
Good morning, everybody. My name's April. I am a certified dental assistant and also a certified orthodontic assistant. I knew early on that I wanted to be in the dental field. I had braces as a teenager, and I was always just intrigued by it and how the ladies worked and that. So it was something I always looked forward to. So when I was in high school, two of the classes that I majorly had to take that would help so that I didn't have to take them at the technical college would be advanced biology and algebra. And actually, the program is a certified program, so it's only a 1-year program, but it's the full 12 months. I actually started my 12-month educational program at NWTC 1 week after graduating from high school. So I bounced from one right into the next, and it was actually a lot easier to do it that way. But I graduated in NWTC in 2002. I did a 6 months in oral surgery, removing teeth and removing wisdom teeth and things like that, realizing real fast that that was not my field. Blood is not my forte. In the fall of 2002, I started a 12-year career with Orthodontic Specialists of Green Bay. And what we did there is we put on braces and dealt with Invisalign and different treatments of bracelets like that. And I was hooked. I loved it. Once you do your certified program, once I entered into Orthodontic Specialists of Green Bay, it was a really intense 12-week training program. There's just so much technology and so much info that comes with the orthodontic specialist, with the ortho field. And then I was there for about 12 years. I took a full year off. Excuse me. I took about a, hang on, I lost my spot. I'm sorry. Then took about, it took me about a full year to understand everything and to just get it all to be smooth and steady while I worked on everybody. Then in the fall of 2012, I stayed home. I tried to stay home with my 2 little kids. It didn't last very long, but a couple of months, and I really missed it. So now I work for Wilkie Orthodontics, and I have been here for about 6.5 years. And I started out, it's a pretty nice, like I work part-time. You can get your hours in 4 days. So I work 3.5 days a week. We have 3 different offices. We have the Green Bay location, the O'Connell Falls location, and the Sturgeon Bay location. So we travel between all 3 of those locations throughout the week time. And my days are pretty busy. I can jump from several different departments. So I'm just going to flip. So one of the things that I do in Sturgeon Bay is I work at our front desk and I answer phone calls and make appointments for patients, deal with any billing that they would have questions on, any insurance. One of the other things that I do as well is I'm also a clinical technician. So this is what our clinic looks like. And we have 4 chairs that each assistant is assigned to a chair a day with a column of patients. And you are responsible for seeing those patients and those different types of appointments. It's really nice because it's not the same appointment over and over. Every appointment is different. So you could start the day with putting braces on and then next take braces off on the next patient and do an adjustment after that. So it's really nice because it's always different. Another thing that I also do is, this is our sterilizing area where we sterilize all of our instruments afterwards. So it's really nice because then I can also jump in here and keep up and help the assistants and keep everything flowing. This part gets pretty busy. Our whole day is a lot of jumble running around and just getting patients in, being seen on time, but it's fast paced and it's a fun environment to work in. I also laid out just a few of the things that we do here at Wilkie Orthodontics. We do different types of braces. So these are just your traditional braces that we do. And then we also do Invisalign. So it's just a clear brace that fits over your teeth that help move your teeth. And then I also help in our lab area if needed. So these are just a few of some of the appliances that we make here in-house because we have a lab right here in our at our main facility in Green Bay. And we go ahead and we make all of these. So we take impressions that make these stone casts, and then from there, we can build all of these appliances for patients. So it's a very nice environment. Like I said, it's very fast paced, but it's fun. You're with multiple people during the day, multiple appointments during the day. I just absolutely love it. Like I said, I've been doing it for about 18 years and I just cannot imagine doing anything differently. It's just there's nothing bad to say about it. It's just, you're always going, you're always moving, and you're always meeting new people. So that is pretty much what I have for you that has to do with the orthodontic and end of everything.
All right. Well, you're talking about braces and impressions, and you're sending me back to 2.5 years of my life when I was in high school. So I remember getting impressions.
Well,
I don't think you ever
Everybody
forget
remembers
that
part.
group that you have to use. To get
Yep.
them.
Yes, it
So
is.
one question I have is, you are a dental assistant and an orthodontic assistant. What are other positions that are found at your particular facility?
Well, we have quite a few actually. We have the front desk ladies. We always have an insurance coordinator. We have somebody that primarily just battles with insurance all day because ortho is a gray area when it comes into insurance plans. And then we have a financial lady who deals with all the billing, the financials, making sure that people are billed properly for their treatment and times and then it's the right amount, also incorporating in the insurance. We also have a few TCs, which are treatment coordinators. They're the ones that when you come in and you meet with doctor, they're the ones that present your case to you. They're the ones that are going to be the one kind of selling you the braces, telling you, okay, this is how long your treatment plan is. This is what doctor has outlined for you. This is how your cost is. And this is where insurance picks up. So, I mean, we have quite a few different roles. And then we also have our lab technicians and then again, our clinical technicians.
All right. So can you tell me the difference between a dental assistant and a dental hygienist?
Sure. A dental assistant, there's a variety of roles. Like I am in the ortho field. A dental assistant can be in the surgical field, the general dentist field. They're one that primarily assists the orthodontic, the surgeon, or the dentist. The hygienist is one, they typically clean the teeth and they're typically off by themselves. They pretty much man their own day. But it's a different, you're dealing more with more in-depth than what an assistant would. So you basically clean the teeth, and you have to, get down below the gum tissue and things like that. So you have to be more certified for a dental hygienist than an assistant.
Okay. All right, Allison, do you have questions?
I do. When you think about your 20 years, 18 years in this space, what have you seen that's changed?
I have definitely seen the way we put on braces. Doctor doesn't put the braces on individually anymore. The assistants do it themselves, and the whole appointment takes about an hour and a half, where in the past it had taken about 4 hours. The different types of braces that go on the teeth. We have new programs that now doctors don't have to bend the wires. We have a machine down in Texas that actually, it's a robot that heats a wire up and bends the wire for us. So it's all done through the computer. We put in what we want for bends and it sends us the wire. One of the major things that I really noticed is we went from a 24-year treatment plan down to a 14-month treatment plan, or 24 months to 14 months. So it's a lot of, it's very come a long ways technology wise.
That's great. So tell me if there was ever a time you were really nervous about something that was happening. And then on the flip side, something that was fun, like a great day, but then maybe something scary that happened.
Yeah. I think when we incorporate something new, we only get when you practice on, assistants will practice on each other to get used to things. But when that first patient comes in and you have to do it live, and you just have, you're not quite sure how it's going to go. You're not quite sure if the software is going to work properly. So it's exciting to be the person that does that first procedure with the patient. But it's also nerve-wracking because you're kind of fumbling through it, trying to be like, okay, I got to find a system, an easy flow, but yet you're still trying to maintain that, yes, I got this. So the patient isn't nervous. Like, what are you doing? So I would think that would be my most nerve-wracking point, is when we try new procedures in clinic and we're just kind of, it's not that easy flow. It's not every day what you are used to. It's kind of a hiccup in the system, but otherwise, most of my days are fun. One of the things that's also a little nerve-wracking is when you pick up the phone and answer the phone and you get a question that you're not quite sure about, because, I deal with a little bit of finances, but we have a financial coordinator that deals primarily with it. So, just answering questions and, just being on your game, top of your game and things like that.
So you talked about and showed us, that was awesome, some of the different types of devices and braces in general. Back, in the dark ages when I had braces, there was only traditional. How would you and an orthodontist make a decision to go traditional versus Invisalign?
A lot of times it's how your bite is, what can be handled, and how much movement needs to move the teeth into the straight position that we want them. If there's too much movement, Invisalign would obviously be out of the quotation. It would just be traditional. But we do have, we have the stainless steel traditional, and we also have ceramic, the clear braces. So we try to soften the blow. We can't offer you Invisalign, but we can offer you clear braces. Invisalign is a great company. It's a great product to have if you have minor adjustments. We're not much of a fan of having Invisalign used on kids, because just like retainers, it gets costly if you throw away your Invisaligns and you have to replace that. So doctor prefers to go the traditional method, but he still does offer that Invisalign in the background. Got
it. So here's my big question, because this was traumatic. Do you still do headgear?
No, we don't.
Yay! You students have no idea what you're missing, and you should be so thankful.
Yep. You got the headgear probably about 7 years ago.
Torture. Absolute torture. Allison, any other questions?
There are no other questions that I see.
All right, well then I will go back to sharing my screen and we will transition to our next speaker. So thank you so much, April.
Thank you.
Oh, actually, one question that we have been asking everyone is we have some students that are interested in knowing, are there positions that would be a good fit for students with disabilities?
Actually, we probably would have positions depending on the disability of the child or of the student. There are some like you know, we would find you could work in the lab, you could work at the front desk, you could greet people at the front desk, you could be a TC. It depends on the disability and what they're looking for, but there is always room for being able to move around and find a position.
Wonderful, thank you. All right, our next guest is Dr. Adam Eicher, and he is an ER physician. So he is going to share with us what that is all about. So do you want me to start with the slides first, Dr. Eicher, or it's on you?
It doesn't matter. I can just go ahead and ramble for a while and see where we go.
Okay.
I'm a little upset though, Lynn, you stole my thunder. I was going to ask about headgear as well. So that
See, I'm not the only one who is traumatized
I was
by
also traumatized. Yeah. So my name's Dr. Adam Eicher. I'm an emergency room physician. So I guess what I will mostly do today is talk to you guys about what made me want to become a doctor, what I had to go through to become a doctor, and how my experience has been being an ER doctor. So I guess from the beginning, I pretty much knew I wanted to be a doctor of some sort when I was very, very young, probably kindergarten, because my grandfather was a physician, and he was one of those old school doctors who, you know, there weren't any specialties back then. The doctor was the doctor, so he was delivering babies, removing appendixes, pretty much doing everything. So I was always really fascinated whenever he would tell stories and things like that. It sounded really cool and like something I wanted to do. But then as you learn more about it, there are a couple other things that you have to realize to become a doctor. First of all, you have to be a pretty patient person because there's quite a bit of education that goes into it. So you obviously need your high school and then 4 years of medical school after that. And then I'd say anywhere from about 3 to 8 years of residency and fellowship training after that. So typically you don't really start your real job, getting a real job until you're, about 30 or so. So you have to be patient for that because you have to go through a lot of training and things, obviously. So yeah, as far as my college experience, I chose to go to UW in Madison. That was always where I wanted to go. So I only applied there and one other school just as a backup in case I didn't make it. But luckily I was admitted to Madison and had a great time there. So one kind of unique thing too about getting into medical school is you could basically have any kind of undergraduate degree as long as you take certain prerequisite classes. So as long as you take, higher level science classes like biology, chemistry, organic chemistry, things like that. And then as long as you get those prerequisites, you could basically have any major. So I went to medical school with people who were philosophy majors, history majors, Spanish majors, but they took the classes that they needed to in order to take the entrance, to do well on the entrance exam for medical school. So that was always pretty interesting. So while I was in Madison, I chose to be a zoology major, and that was because a lot of schools have a pre-med major, but they didn't at Madison. They had like 20 different kinds of biology, and I just chose zoology because you could take a lot of classes to get credit for your major. So one of my favorite classes I took was primate psychology. That was quite interesting, getting to watch a bunch of videos about monkeys in the jungle and stuff like that. That was funny. So but yeah, so then off to medical school I went in Iowa. And so basically in medical school, the first 2 years of training are all in the classroom doing things like anatomy, pharmacology, microbiology. And then your third and fourth years are when you get out in the clinics and the hospitals and start getting real hands-on experience and training. And those are the years that you need to start thinking about what kind of specialty you would like to get into after being exposed to a bunch of different things during your clinical rotations. So I chose to be an ER doc. So I guess what kind of tilted me that way was I was intrigued by the idea of having basically just shift work, not having to be on call. So when you're working, you're working. When you're done, you're done. You don't have to be tethered to a pager, you know, in the middle of dinner and things like that. I like the idea of being able to see basically any type of acute medical problem, having the ability to do that. And I also liked not having to worry about, you know, if they have the appropriate insurance and things like that, that I didn't have to have all kinds of restrictions on or that the patients didn't have to have any restrictions either. So I was able to see whoever, you know, I treated everything, people from homeless people to Packer players, and you have to be comfortable dealing with all sides of the spectrum, all kinds of cultures and languages and things like that. And those were things that I all found really appealing. So the other thing that I think is fun is all the procedures that, you know, I was trained to do and that I get to do, you know, things like, you know, running codes for patients, putting in chest tubes, doing spinal taps or lumbar punctures, fixing, you know, wounds and lacerations. My favorite thing to do is to joint reduction. So if someone comes in with a dislocated shoulder or hip, those are always kind of fun to hop back in. We put the patients to sleep to do that, but they're fun to do. Yeah, so those are kind of the good things. Some of the bad things with ER, things that you have to balance out, pros versus cons, is it's kind of hard to have much rhythm to your life because, you know, you depending on your group, how things are set up, you know, you're going to be working holidays, you're going to be working weekends, you're going to be working nights. So, you know, you're going to miss some things in life, but there's also big time positives to having a career in medicine, being able to truly help people. And, you know, it's a pretty great feeling when someone comes in basically coding or without a pulse or not breathing, and you're able to work on them and basically bring them back to life. And, you know, you get a pretty great feeling being able to do that and to help people in such an extreme way. So yeah, I basically, after my residency, I started working in the ER here in, at Bellin Hospital here in Green Bay. So I was one of those kids who, you know, growing up, you're like, oh gosh, I'm never gonna live in Green Bay again. I can't wait to get out of Green Bay. But after a while, you realize it's not that bad of a place. And good people, great medical system, and a good group to work with. So that's kind of the basics of my story.
All right, let me just see what you had on your slide. So can you tell us a little bit about, like, I'm going to share slides so they can see some of the places that you've been. Do you have some say in where you get to go during your residencies? Because you did some traveling pretty much all over.
I chose the medical school that I went to because they were very flexible as far as you kind of setting up your own rotations. So some like bigger medical schools that have big teaching hospitals, you're kind of just stuck at that one hospital for your third and fourth year. Whereas I was basically able to set up my rotations as to where I wanted to go, you know, as long as I had to get, you know, so many months in family practice, so many months in, you know, radiology, different things like that. So as long as you got the months that you needed, I could pretty much set them up anywhere. So, and at the time I was, you know, single and untethered. So I decided I want to do 6 months in Tampa over winter. And then from there, I went to Portland, Oregon for another 6 months and loved it out there. So, and then more in my fourth year, I was doing rotations at hospitals in the emergency rooms where I was considering doing my residency. So those were mostly in Michigan and the Chicago area. And then, so kind of equally, I chose my residency program because they were also not strongly affiliated with just one hospital. So over the course of 4 years in my residency, I counted that I worked at 12 different emergency rooms. So it made me, I think it really helped me to be adaptable. So, I worked with many different kinds of charting systems, writing on paper versus different kinds of computer platforms. So I think the diversity of that really helped my training as well. And, I was working, I did my trauma month and my toxicology month at Cook County, so you get exposed to pretty much everything there. And then I would also be working at, fancy suburban hospitals where you take care of people on the other side of the spectrum. So I think that all the diversity really helped me feel confident about being able to pretty much work anywhere when I was done with my training.
We do have a question, Dr. Eicher. What area of medicine did you not enjoy when you were trying different types of medicine?
Oh, I would say, boy, that's kind of hard. I would say, probably pediatrics. Even though I liked taking care of kids in the emergency room, I think it would just get a little too monotonous just seeing kids all the time. Like, I like to be able to see young kids and elderly people, men, women, so yeah, I would have to say that. Or something like OBGYN, where you're just restricted to seeing women, that might, I mean, I like women and all, but every now and then it's nice to see a man as well. But yeah, so I think things that are just too tightly, specialized to just seeing a tiny, subpopulation, I think I would get a little bored with.
Sure, you get to see it all.
Yes.
Don't matter. Another question, how many ER doctors are on during a shift at a hospital, or is it just you?
Well, it depends where you are. It depends what the volume of your, the volume of your ER, how many patients you see. So at Bellin, we have a 16 room emergency room. And we see about 35,000 patients a year. So on night shifts, it's just one doc and you're on your own. So you're all by yourself. You got to take care of whatever comes in. During the day, we have kind of an overlap for part of kind of the high volume hours from like 10 to 6, where we'll have 2 doctors on. And
so there's more emergencies.
Yeah, exactly. Funny how that works, right? So,
okay.
Whenever they're convenient for their emergencies, they come in. And we also have nurse practitioners or PAs that help. So usually during the day, there's always NP or PA with the doctor, and occasionally we have 2 doctors on with the NP or PA.
Okay.
Mm-hmm.
Another question. What was your favorite hospital that you worked at? Maybe let's say besides Bellin. So
yeah,
okay, besides Bellin.
I would say Cook County was pretty amazing to to work at. The experience there. So we would work basically 24-hour shifts in the trauma unit there. So, and it was busy. There were gunshot wounds every night. We'd be doing major procedures right there in the ER, cracking open chests and things like that pretty much every night. And it was, you see it all in those months there. So that was pretty an eye-opening experience, and really exposed you to pretty much everything you needed.
How do you learn to crack open a chest? Well,
there's an old adage in medicine where they say, see one, do one, and then teach one. So you kind of, as you're a resident, the first time you see one, you're like, oh my gosh, that's how you do it. And then after you see, one of the attending physicians or a higher level resident do one, you're expected to pretty much be able to do it. And they talk you through it and things like that, but then it's on to you after you're comfortable with it to teach the interns or the lower level residents below you. So it's just kind of every day you learn something new, and you have to really have the ability to absorb a lot of detailed information.
Mhm.
But
Do you remember your first time being scared?
yes, one of my, after starting my job at Bellin, the first time I was on a night shift by myself, you're just sitting there waiting for something to roll in. And my first patient that I got as a true working emergency physician was a patient who was coding and came in by ambulance and didn't have a heartbeat. And I had to shock them and intubate them, putting a breathing tube down their throat and everything like that. So when all that was going on, it was pretty nerve-wracking, and I was scared. But it turned out great, and I was able to get the patient admitted and up into the ICU. So yeah, there are plenty of times where you can feel a little nervous. Another time I was very nervous was when I was a medical student and I was doing my first ER rotation, and that was down in Tampa. And I had never put stitches in anyone before. I was trained how to do it. In medical school, you do it on kind of just little dummies and stuff like that, and learn the technique of it. And in the ER, there a patient came in by ambulance who didn't speak a word of English, but he was a landscaper. He was working in landscaping, and he had a chainsaw, and he was trying to cut down a tree limb with his chainsaw, but he dropped the chainsaw, and it pretty much just went down his leg. And the attending who was on said, "Adam, why don't you go sew up that patient in there?" So I had to put in over, I think it was like 180 something stitches in this guy's leg, and it wasn't a nice clean cut because chainsaws don't make a nice straight line to sew up.
On skin, yeah.
So it took quite a long time, and there wasn't a whole lot of conversation because I could not speak this guy's language, but I was pretty scared trying to do my first stitches on a wound that was so severe. So that was also a little unnerving.
There's two more questions that I see as of right now. How do you know where to go or what to do after medical school? How do you go about finding a job?
Well, that's a good question. I guess first what you do is you kind of figure out what area you would like to live in, what city, what state, and then basically just start calling people. There are physician recruiters at most hospitals, so you can contact the recruiters. I kind of just chose Bellin, and I was in touch with the recruiter, and she connected me to the ER group, and I just interviewed with them, and fortunately got the job. But so if you can kind of narrow down what city you would like to go to, and then look into the different hospitals, you kind of choose if you want, a trauma center or a lower level ER, if you want a busy ER or a not busy ER, and kind of filter things out that way, and then contact the administrators at those hospitals, and they can help you, let you know if they have openings in the ER group or not, or they can help guide you to other places as well.
Okay, so there's people who help
Yes, absolutely.
And through school, you are narrowing it more and more too.
Yes,
So by
absolutely.
experience, yep.
Right.
Another question, right now it seems to be the last one. How hard was it to get into medical school? What exams do you have to take?
It's very hard to get into medical school. So I think, basically, like I said, to get it into medical school, you have to take those certain prerequisite classes. That it seemed like, that's a lot of chemistry and physics, anatomy, things like that. So there's one prerequisite that seemed to be the big filter as far as if people wanted to continue pursuing a career in medicine, and that was organic chemistry. That was pretty much the hardest class I've ever taken, and that was in college. And a lot of people either failed organic chemistry or said, I don't think I'm going to go into medicine anymore. But then kind of between your junior and senior year in college, you take an exam called the MCAT, the medical college admissions test. So basically you need to have You have to do very well on that, and you have to have a strong GPA to get admitted to medical school. The other things that are really important is it's really good to have volunteering. They like to see that. They like to see if you've done any research, things like that. They just don't want somebody who wants, they want kind of a well-rounded individual, and someone who seems to be truly committed to the profession.
Sure.
So
wonderful.
Okay, I see that's our last
you.
question. So thank you so much, Dr. Eicher, for joining us. And we're going to transition to our third guest today because I see that he is on. So Jason Helgeson is the Vice President of Clinical Operations at Pravea, and he's going to be talking to us about health administration. So take it away.
Good morning, everyone. Yeah, thanks for having me. I guess I'll take it over from here.
Yep.
I can go to the next slide. Good afternoon, everybody, or good morning. Nice to virtually meet you all. Wish I could see your faces. I do have 3 teenagers that are all at home on their computers also, so I can empathize for those who are having to do with virtual learning. I understand it's not the easiest thing to do, and there certainly comes with some challenges, and you got to be very self-motivated and disciplined. So hang in there. I can assure you there is light at the end of the tunnel, and it's not a freight train coming through the other side of the tunnel either. There's actual hope. So anyways, just a real touch base, kind of gauging the temperature of the room here and how everyone out there is doing. I understand you're all muted, can't talk to me, but I can remember back to a nice warm summer day when taking a drink out of a nice cool hose, and just life was really good. And if you think back far enough, that there was a time like that and life was pretty chill. If you go to the next slide, this kind of better depicts how we feel in healthcare right now, as things are changing at a rapid pace, and it impacts you at home as well and your families. You watch the news, and it's everywhere. We're talking about the coronavirus and the impact it has on everybody. And as someone that works in operations and how things work in a clinical and a hospital setting, this has really been my life ever since March rolled around. Next slide. So my career path is, this image kind of caught my attention. So I use this winding river. And this is encouraging you out there to keep an open mind. How do you know when you're 16, 17 years old, what do you want to be? What is your passion? How would you even know what your passion is? You haven't had a chance to go experience the world and experience the workforce. So it's really difficult when people say, go for your passion. Passion doesn't always pay the bills. So finding something you're gifted in, a class or a teacher that's kind of inspired you, and kind of explore, talking to your guidance counselor or folks at NWTC, what opportunities might exist in those areas that kind of come top of mind. So for me, healthcare, I've had various athletic injuries growing up as a young athlete in high school. So I was always intrigued by therapists and sports medicine doctors, things like that. So I did get into sports medicine through UW Green Bay, and did some time with the Green Bay Packers, some arena football teams, some hockey teams, local high schools, things like that. I became a strength and conditioning coach, opened up a fitness center within Pravea Health, and quickly decided I was really interested in the meetings. I liked going to the strategic planning sessions, the innovations, looking at budgeting, things like that. So I went back to get a master's degree, and got a master's in business, and that kind of opened up a few other doors, and I kind of explored other areas, from being a coordinator to a manager to an executive director. And now my current role is I'm Vice President of Operations for Pravea Health, right here in Green Bay, Wisconsin. Next slide. So you might say, what does a VP of Operations do? Some days I feel like we do everything. But quite honestly, I'm not considered the medical or clinical person. So my job is looking at budgets. So if you like numbers, and again, I know a lot of you may be on this call thinking, I just want to be a nurse, or I want to be a doctor, I want to be a therapist. We need all the clinical help we can get. But if you're one of those people that's grossed out by blood, or you're not sure, you want to have that direct patient contact, and it's scary for you, and the nights and weekends and holidays and all the hours are very difficult, there's other areas of healthcare. You can get a degree in business or marketing. There's a number of areas. So as you can see on this list here, budgeting, that's a lot with numbers. You know, we have forecasting people and the decision support people that help make decisions. People that look at compensation for physicians. As you know, they make a fair amount of money. So we have comp analysts. I do a lot with our facilities, building new clinics, building surgery centers, renovating, updating, things like that. Staffing, so a big part of approving every week we have an open hire meeting, and we look at probably 10 to 15 positions every week, ranging from plan ops to a CNA, to a CMA, to a lab tech, to a physician assistant, marketing person, you name it. I get a chance to look at those requisitions and have those leaders explain to me why we need this position, why we need to replace somebody that just left, why we should add on that additional expense. So I always find it intriguing to learn about each different area of Pravea. It's over 2,000 employees. We're over, when I started, we had, I think, 60 physicians and 3 clinics. We now have over 100 clinics and we have over 500 providers. So we're really seeing a lot of growth here. So that's one of the mentions here also, not just strategic planning, but regional growth, looking at different markets that we can serve beyond Green Bay. And you'll see that on a map coming up. Innovations, if you like to be creative, innovative, there's always technology components of how we can have patients not have to make a phone call, how we can treat patients from just being in their home using an iPad or technology that allows us to see their blood pressure, heart rate from a different location. So the list goes on. There's jack of all trades for sure. Next slide. I just want to give a quick snapshot of some of the things that I've been working on that might interest you. This is just what we call a heat map. So this is the state of Wisconsin, and the red dots really are condensed areas of where we have been testing patients for COVID. And hopefully you've been able to avoid our testing trailers, but if you haven't, you know, those testing trailers, that's something that was an idea we came up with back in March or April, and we thought this would last maybe 6 weeks. How can we build something that'll last a month or two? People can drive through. We'll put in some computers, printers, some lab folks, and some nurses, and we'll create some signage and we'll put them through this testing trailers. Well, little did we know we'd be doing nearly 15,000 tests a week, 7 months later with no end in sight. So these show you kind of the heat maps of where we have, I think, 9 testing trailers, and we're condensing those due to colder weather. Next slide. So this gives an idea just how our mind works. So I know it's going to get cold out. So all those 9 testing trailers aren't going to work very good when people have to go outside to a vehicle and test somebody, do that nasal swab. So Sheboygan's just one example. So we looked at this strip mall here. Next slide. You probably don't even remember Family Video because your era probably never went to a video store, but this, as you can see by the green carpet and the orange countertops, was a vacant Family Video store. And we thought this will make a decent walk-in COVID site. Next slide. So we took that empty space and then we work with our process improvement people, our plan ops people, our operations people, and we kind of map out in our minds, how would this work? We need a door in the bottom right corner. The patients will walk in, check in, get their sticker, go through, get their swab, where we'll put the computers on wheels and the patients will walk out, make sure there's no congregating of people and keep it as safe as possible. Next slide. So this gives you what it looks like today. Nothing fancy, but we had our plan ops guys build some walls, little alcoves there. Patients could walk through, get their swabs, and walk out the door. So just one example of, you know, one day you're doing a drive-through trailer, the next day you have a walk-in. Next slide will give you a different example here. What we're doing in Green Bay is I wanted actually to have a drive-in rather than drive-through. So this is the Brown County Arena, or Brown County Fairgrounds. For anyone who's ever been to the fair here in Green Bay, I saw there was a big empty expo hall. So we went out there a couple times over the last few months, met with these folks, brought our plan ops people, our IT people, our operations lab, everybody out there, marketing, said we need to make some signage. We need to create a little, put some more yellow tape on the ground, bring in some IT, bring in some heat. And we have a way now for, we're able to close our East Mason, East Appear, and Ashwaubenon testing sites and consolidate everything to an indoor drive-in testing facility. Is it perfect? No. We have 2 big garage doors where they come in and go out. They have to stay open all day. So all the hot air we pump in kind of falls right out the windows and doors. But it's better than what we were currently doing with our trailers. Next slide. Something I'm always looking at is numbers. So if you like numbers, maybe a future in healthcare management or administration would interest you. This just gives an example of volumes. Every week I look at what volume percentage are we at this week compared to last year during the same week. Obviously with COVID, we have, like today, we have 65 employees and or physicians off due to COVID. Either they have it or someone in their household has it. And so that means there's a nurse missing, a physician missing, a schedule that's being canceled. And even more importantly, because it's such a high positivity rate in our community, we have a lot of patients canceling their appointments, whether it's a shoulder surgery, meeting with their endocrinologist, coming in for a physical, coming in for labs, whatever. So our volumes are not where we expected them to be, but it's really expected when you have such a high positivity rate. Next slide. This is just an example, a small picture of a waiting room. Another, a job that we have to do is we have our PSRs, we have schedulers. It's an entry-level position, but it's a very important position. So they check the temperature of our patients. They ask them a few questions, they register them, or they check them in for their appointment. And then they get out into those waiting areas and keep everything clean and tidy and safe and make sure everybody is socially distanced and not congregating together. It's the right thing to do for our community to keep them safe, knowing when they do come to a clinic or hospital, it's the safest place they could be. Next slide. This just gives an image of one of the projects I'm working on right now. The image to the left, if you drive down Highway 29 and 41 on the west side of town, and maybe you do that if you're over there on the west side of Green Bay, that's the medical office building. It's right across the street from Fleet Farm. It's that size right now. It still looks green and yellow because all the insulation and siding is still being put together. We haven't put on the outside brick yet, but that'll be up and running in March. It's I think a 5-story, 80,000 square foot medical office building. So we had a lot of fun designing that. But even more exciting for me is the one in the forefront of that picture is an ambulatory surgery center, which we're looking to put on that campus as well. And we're very excited to offer that to our community for those who don't need to go into a hospital setting for a very predictable, shorter type of a procedure, a foot procedure, a GI procedure, some minor outpatient orthopedic surgery. We can get them in and out of this more current state-of-the-art facility in a very quick time frame. And quite honestly, people like to avoid hospitals if at all possible. They just associate them with sickness and it's more institutional. This is more contemporary and quick turnaround. Next slide. I really see what I do on a daily basis like an orchestra, like a symphony, and it's just leading a group of people. And if someone doesn't show up or doesn't do their job, something falls apart. Just yesterday, Dr. Rai, who I report up through, approached me with a concept about some infusions that would maybe be available as an experimental infusion for patients that are higher risk that have tested positive for COVID, but they could receive this infusion that may prevent their symptoms from getting worse and with them ending up in a hospital or something even worse. So within 24 hours, I found space. You find IT, you find marketing, plan ops, got to have a contract, got to have compliance involved to make sure there's a consent form for the patients. There's 20 some people I need to pull together to do a site visit and get them in a meeting, which is all Zoom for me as well, and say, how can we make this happen and go live on Monday? And there's so many builds from an IT standpoint and fiber and ordering IV pulls and recliners and who's going to staff it. And it's intense, but quite honestly, I thrive on the urgency and knowing that it's going to help our community. I think that's what drives me more than anything. All right, no, you can go to the next slide. This one, it's a little digital, hard to read on my screen. I don't know if it's just buffering. But
Oh, it came through kind of fuzzy, so I wasn't
okay,
sure. Yeah.
skip it. Just go ahead and skip that one. Yeah. So advice for you, and I don't know if you're looking for advice. First off, I think NWTC is a wonderful, we're very fortunate here in Northeast Wisconsin to have NWTC. I can tell you my wife went back as a non-traditional student to get her associate degree in nursing, and has had a wonderful 15 or 20-year career as a nurse. My sister-in-law happens to work for NWTC, and we've hired a number of people. I know we work very closely with NWTC because we love to get their MAs and CNAs over here. But there's many areas we like to work with TC. So if that's something you're considering, definitely 2 thumbs up on my end for that. But advice for you, like I said, it's hard to know what you're passionate about if most of your life is just hanging with your friends, going to school, playing sports, doing video games, social media. Like, how do you know professionally what you're passionate about? Try to find something, because I can hire somebody on passion and teach them some competencies on how to answer a phone or how to room a patient, how to read a report. But if they just are not that enthusiastic, it's really going to make going to work hard. Being kind. I can't say that enough right now. There's a lot of stress. Everyone from physicians to senior leadership and everyone in between is dealing with stress on a different level. Kids are at home on school. Everybody's unhappy. There's COVID. There's loss of life. There's people that are very sick. There's uncertainty. There's elections. And we really just need to be kind to one another and try to be understanding. We haven't walked in others' shoes. I do like when people challenge the process, even if it's my own children. It's through my church. It's through my work. I think if we can do it respectfully and try to look at things in a different perspective and challenge that respectfully, I think that's how things evolve and grow and develop versus stay stagnant. It's good to have interests outside of school and work. So hopefully you have hobbies besides electronics or your phone or video games. So whether it's exercise, for me, I like to run. I've just got a Peloton bike. So now we do some cycling downstairs. I've done endurance events. To me, I like just being outside before I come into work. So I end up sitting at the computer most of the days now because we don't have many in-person meetings. Of course, strive to be the best version of yourself each and every day. It takes discipline, and be a lifelong learner. Once you feel like you've accomplished what you set out to do, even me, I'm 48 years old. I continue to learn. I continue to educate myself. I continue to read, attend courses, etc., to continue to challenge and be the best version of myself. Don't ever just rest on your laurels. Like, hey, I've got the degree. I'm good. I know everything. It's like we never know everything. There's always more to learn. Next slide. This is my last slide. That's my daughter, Sydney, on the left, Zach in the middle, and Josh on the right. Josh is a senior at Preble, and then Sydney's a sophomore, and Zach's at Red Smith. And my wife, as I mentioned, I've been a nurse over at St. Vincent Hospital for the past few years, working in home health. And I've been here at Pravea now for over, I think, 23 years. It's been a wonderful career. It's opened many doors. You just got to keep your eyes open to what you're being called to do. Because I never would have thought, 23 years ago when I was doing athletic training, covering high schools and things like that for Pravea, that I'd be overseeing all the operations statewide here for a wonderful organization. So I know we're getting close on time. I'll turn it back to Allison and Lynn and see if there's any chats or questions for me today.
All right, Allison, any questions?
I do not see any questions. My quick question for you, just like, besides COVID, does something stick out to you as something significant that's changed? I know that could go many directions, but just something that pre-COVID that has changed.
Yeah, technology is changing things. I think televisits, like we can do telestroke, so you can have a patient show up in our hospital with a stroke. We don't have neurologists in every hospital. So we work closely with St. Mary's, St. Vincent, St. Nick's, St. Clair, Door County. So we don't have a neurologist 24/7 at St. Nick's. So if your parent or grandparent shows up to St. Nick's with a stroke, we turn on a computer screen and boom, within 30 seconds, there's a physician at UCLA, out in Colorado, out in New York City, and they are assessing that patient. They're assessing their pupil dilation. They're reading their chart. and they're assessing their care virtually. It's becoming more and more common. And for your age, these young people on this call, that's going to be healthcare as you know it. Your healthcare is going to be right here. It's going to be right on your phone. You'll be able to assess most of your vitals at home. You'll be able to see your physician from home, televisit, phone visit. It's already happening right now. So I'm curious to see in the next 10 or 20 years how far this can go. But I would say that's the biggest thing is technology.
Awesome. Well, thank you so much for joining us today. This was just fascinating information. Just a reminder that next week we are hearing from 3 of our post-secondary institutions. So NWTC, UWGB, and Bellin College will all have representatives next week telling us about their programs. And we absolutely love to hear from our students and staff and parents even that are joining us at these virtual job shadows. So please do fill out the evaluation survey. That link should have been sent to you ahead of time. And that should do it. We're at the top of the hour for our presentations today. So thank you to all 3 of our presenters for taking time out of your busy day, especially in the atmosphere that we're in right now, to share with us about healthcare. Thank you so much.
Thanks for having me.